let's talk hormone replacement. So why do women get hormone replacement when they get to menopause? Well, to control symptoms, to decrease their risk of cardiovascular disease because estrogen is protective. And so women before menopause, they have a way lower risk of cardiovascular events and diseases than men. But then when they reach menopause, their risk is actually a little bit even higher, equal to higher. And also to help with bone health, so maintain bone density, and to prevent cognition problems, so dementia. And this is all because of the decline in hormones that were before protective. So there's a critical period for this to happen. So for you to get the maximum benefits of cognition, for example, you have to start HRT 2 to 3 years into your menopause. So when you start having those perimenopause symptoms, it's time for you to go see your doctor and go find out if hormone replacement therapy is something that can be done for you, because obviously it's not for everybody, and we'll touch on that. So there's also a critical period for bone health and cardiovascular disease, and that would be up to 5 years into menopause to protect you from cardiovascular risk and osteoporosis. For symptoms, it's really anytime you start HRT will benefit your discomfort in terms of symptoms. So first message from this video is, as soon as possible, go find a doctor that does hormone replacement therapy to evaluate if it is good for you, because there is a critical window, therapeutic window in terms of cognition, and that would be the first one, and then cardiovascular disease and osteoporosis. So you want to start early, and you want to go for the shortest period of time. So not up to 10 years, and that would be the maximum. And you really want to work on the body as much as you can to reduce risk factors in other ways as diet and lifestyle, stress management, sleep, and all that, so that you're not taking the hormones for too long. And also those symptoms will end up coming under control once you alter the environment. Because remember, all the women in the world go through menopause. All of them have the same decline in androgens and hormones, but not all of them have the same symptoms. And the way we are suffering here in the West, it is lifestyle related. It is our inflamed bodies related. So once we work on that body, we can taper down the HRT so that you're not taking hormones for a longer period of time. Also, above 65 years old would be the limit. You would not give HRT to an older person typically. Of course, your doctor will evaluate with you if that is the case, but in general, up to 65 would be a hard stop. And another note on timing is that women that have their ovaries removed, so they go into menopause because they are not producing, they should go on HRT as soon as that happens, and given to them until more or less 52 years old, because that is the average age of a woman's menopause. So your body was expecting those hormones for your bone health, for your cognition, brain health, and for your cardiovascular protection up until 52. So your body is not prepared to be suddenly in menopause at 40 or at 30 something whenever you got your ovaries removed. That's one thing. And then women who, for example, went into early menopause for some reason, either they had a hysterectomy, they just took their uterus, but the ovaries were left in, but the irrigation to those ovaries is compromised when you don't have a uterus. So you tend to go into early menopause, and then other reasons for early menopause, maybe chemotherapy, maybe stress. Too much stress can push a woman into early menopause. Regardless of the reason, if you go into early menopause, it is very beneficial if you give this woman HRT until she is at least 52, because then that is when the body was expecting to have those hormones in upper levels. Understood? Timing? Okay, that was the first. Second is, obviously, there was a fear and studies that showed that hormones, especially progestins and some types of estrogens, would increase your risk of endometrial cancer, of breast cancer, and just inflammation in general. The reason behind that is twofold. One, the hormones that they were using before were equine. They were from mares. And the progesterones were actually not progesterone, it was a progestin, which is a synthetic compound, and your body did not know what to do with that and would react to it, and it would increase the risk of breast cancer. Much has changed, and nowadays there are bioidentical hormones that are very similar to the human hormone. Does that mean that now that the hormones are bioidentical, I can take them indiscriminately? No, because the other reason that hormones can give you problems, and this is probably the major reason, is the environment in which you're inserting those hormones. So if you give these hormones to a woman that is inflamed, insulin resistant, dysglycemic, meaning her blood sugar is all over the place, she does not poop well, so she is reabsorbing this estrogen, these estrogen metabolites in her gut, you will have problems. If you give this estrogen to a woman that does not metabolize estrogen well, meaning estrogen has 4 metabolites. 2 of them are cancer forming, and 1 of them is protective, so good, and 1 of them is neutral. Well, guess where an inflamed, insulin-resistant woman, their metabolites go down where? Go down to the cancer-forming ones. And so you have to check metabolites in the urine of this lady before you give them hormones to know that she is adequately getting rid of, metabolizing and getting rid of this estrogen, and that it's not being reabsorbed in her gut. So second message of the video is that so hormones are great for symptom relief, for cardiovascular protection, for prevention of dementia, for osteoporosis. There's a critical period, but it's not indiscriminate. You have to work on that body. So there's a red light, there's a yellow light, and there's a green light. So most benefit would be a lady that has very, very low risk for breast cancer. So she doesn't have a family history. Obviously, she never had cancer before in her breast or wherever. And she has a high cardiovascular risk. And that person will benefit a lot from hormone replacement therapy, but you want to work on that body so that her cardiovascular risk can be decreased by other means besides the hormones, okay? Yellow light would be those ladies that are inflamed, that they're not pooping well, that they don't metabolize estrogen well, they are dysglycemic, meaning their diabetes is out of control, or they're pre-diabetic, or they're not pre-diabetic or diabetic, but they still can't hold their blood sugar under control because of their diet is so awful, and they're insulin resistant. So you want to test for these people, and you can give them HRT, but you need to work on this body first, so that you're not doing more harm than good. And then red light, unfortunately, there are some people that is very contraindicated to take HRT, and those would be the women with a history of cancer, an active cancer, mainly of breast and endometrium, a strong family history, a mother, a sister with breast cancer or endometrial cancer, a person that have a risk of thrombosis. So some people have certain genetic SNPs or genetic propensity to form clots. You do not want to give HRT on these people, and people that had ischemic strokes. So an ischemic stroke is also probably because of a clot. There was an interruption in blood flow right there to the brain. So for these people, it's unlikely that you will get HRT, and unfortunately you would have to try to manage these symptoms with herbals, phytoestrogens, and just diet and lifestyle in general. But obviously this is to the discretion of the doctor. I'm just giving you general information. I cannot prescribe hormones. I'm just giving you the information that I know so that you know what to ask for. So critical period, we talked about that. And usually it's good to give a combination of estrogen and progesterone in combination. That would be the most benefit. But what do you have to measure before? And you make sure that you're asking your doctor to measure these things. The level of baseline estrogen, so level estradiol, the metabolites, and that you will measure in the urine. So you want to know how this woman is transforming her estradiol into all those 4 metabolites. If she's always producing just the cancer-forming ones, maybe you don't want to give her extra estrogen for that to go down that pathway, right? You want to measure DHEA. because that would be telling you if you're giving this woman hormones, if she transforms some hormones, depending on what hormones that you're giving her, she'll transform that into DHT, and that'll cause baldness. Insulin, so you want to make sure she's not insulin resistant. The glucose, obviously, to know if the glucose is in control. The inflammation marker called CRP, and leptin. And leptin is also something that will increase an enzyme called aromatase. And aromatase is an enzyme that will get your testosterone, either the testosterone from your body or the one that you're giving exogenously. Some people give HRT, including testosterone. This woman that has leptin resistance, insulin resistance, or is drinking too much, there are certain things that turn on this enzyme a little bit more. So you're transforming all your testosterone into estrogen. So too much of estrogen will be a problem as well. So you want to measure all this before you start the HRT. And I know that some people think that it's just, oh my gosh, I'm so miserable, these symptoms, and it's just HRT will solve my problem. It's like the supplement thing. It's like the medicine thing. Yes, it can solve your problem, but be careful. This body is much more important than something you're putting into it. Do you understand? So working to reduce those risk factors and reducing those things that keep you inflamed and in pain is much more valuable than taking something external to kind of fix the problem, but not fix the problem. And what else? And the food. So you want to eat a lot of cruciferous vegetables because that pushes the ratio of the estrogen metabolites towards the good side. So towards the good protective metabolites of estrogen. So a lot of cruciferous vegetables, the stinky ones that smell like fart. So broccoli, Brussels sprouts, cabbage, and all those good things. A lot of green tea for the same reason. It acts on the enzymes, and it can inhibit aromatase. It can help you with the detoxification of those estrogen metabolites. So very good to have a lot of green tea. A lot of antioxidants so that you can tone down the inflammation in your body. So antioxidants always translate into color in your diet, and teas, a lot of teas. And try a diet that is not as inflammatory. So the Western diet is inflammatory. There's a lot of flour, there's a lot of sugar, there's a lot of simple carbs, there's a lot of fried things, rancid oils, trans fats, processed stuff, preservatives, xenoestrogens. You do not want to be eating artificial estrogens from putting on your skin and eating through pesticides and all that, because it tricks your body. It turns on the bad estrogen receptors. Okay, just think of it like that. So you want a very anti-inflammatory diet. I think I touched on all the points today. Let me just really quickly glance here to see if I have anything that I didn't say. So again, caution in an obese person, because the more fat you have, the more insulin resistant and the more leptin resistant, but also fat is a metabolically active organ, meaning that it will transform, it has aromatase, it has that enzyme that will transform your testosterone or whatever testosterone you might be even taking. It's not typical to give testosterone and HRT, I mean, not for most part, but anyway, it'll transform your own or exogenous into estrogen, and that would be a little bit too much. Dysglycemic people, inflamed people, stressed people, insulin resistant people, people that have dense breasts, that have inadequate methylation, because that is one of the ways to get rid of estrogen is by methylating it. People have a lot, it's very common for you to have a genetic SNP that impairs your methylation. You don't methylate very well, meaning you're just adding a chemical group to a compound to eliminate it. Constipated people, because of that reabsorption in the gut, and when you have a estradiol baseline very high. So you want to work on that before you start HRT, just so you're not having problems. But HRT can relieve you of symptoms, can decrease risks of diseases, and it can be a good thing. Just really beware. This was more of an awareness raising before you go out and try to put something on yourself on your own. Okay.